Hi, I'm Dr. Beltry from Beltry Bariatrics. I am a bariatric surgeon in the Orlando area. In this video, I'm going to be talking about pregnancy and bariatric surgery. When should you get pregnant? Should you get pregnant? What happens if you get pregnant before you are supposed to? All these things are very important. And these are questions that my patients ask me all the time. So I hope this video is helpful. First of all, let's talk about, can you get pregnant after bariatric surgery? And the answer is definitely yes. However, you need to wait after your procedure before you get pregnant. Normally, we like the patients to wait at least 1 year after the bariatric procedures before you pursue getting pregnant. After a year, your weight loss has stabilized and you should be able to carry out the pregnancy with no issues. Also, after losing a substantial amount of weight after bariatric surgery and you get pregnant, there's less gestational diabetes. These are studies that have been actually done that show less gestational diabetes, less C-section. There's more natural vaginal birth after losing adequate amount of weight through bariatric surgery. However, you still need to wait at least a year until your weight loss has stabilized before you go ahead and get pregnant. When you decide to have a baby after the year of your bariatric procedures, you need to stay in touch with your bariatric surgeon and your obstetrician, of course. Why? Because first of all, I need to make sure that you've been taking your multivitamins, right? Because you're going to get pregnant. Your calcium level, fine. Your multivitamin level, okay. Your iron, your B12, things of this nature. So very, very important that you have been taking your multivitamins. Important that you have been doing your lab work and making sure that you are adequately replenish your body with the multivitamins that are needed. These are also going to be important from the obstetrician standpoint. He or she will want to make sure that you are healthy enough to undergo the pregnancy. Are there any symptoms that need to be addressed? Remember, getting pregnant might change things. Pregnancy, it's a metabolic condition in and itself, and you might have been doing okay during your weight loss period, but now that you're pregnant, you might be experiencing things like nausea, vomiting, things of that nature that were not there before. Gallbladder issues can come up. So very important that you stay in touch with your bariatric surgeon and your obstetrician, and that both are communicating regarding the pregnancy. Now, I'm going to talk about what happens if you get pregnant before you're supposed to get pregnant. And by the way, this happened to me a few times. There are patients that, especially female patients, that suffer with infertility from PCOS. You may or may not know this. Bariatric procedures, because these are metabolic procedures, can actually reverse PCOS, therefore reverse infertility. And I have patients that come to me, tell me, Dr. Beltry, you're asking me find some kind of birth control after my surgery, but the truth is I've been trying to get pregnant for the last 5 years, been to fertility clinics, and I cannot get pregnant. So, and I'm telling you, I said, you will get pregnant because the surgery can actually reverse the infertility caused by the PCOS. And sure enough, I have patients that gotten pregnant. They didn't listen to my advice and they got pregnant 4 months after their surgery, 6 months, 5 months after their surgery. Thank God they all were able to carry out their pregnancy, but a couple of things will happen, okay? Number one, you will stop losing weight. The metabolic effects of the surgery takes over and you stop losing weight. And then after you give birth, it will be very difficult for you to kind of get back into the metabolic changes that the surgery causes. Because remember, procedures like the gastric sleeve, the gastric bypass, the duodenal switch are metabolic procedures. They cause certain types of changes in your body that make you lose the weight fairly quickly. And the pregnancy is going to take over that. And if you get pregnant before the year is over, well, the weight loss is going to stop. And after you give birth, going back to that rhythm of losing weight again might be very difficult. Second, very, very important also, is that you might put the fetus of the baby at danger. You were losing weight, your body was still changing very rapidly with the weight loss, and now you're pregnant. Things are going to come up. Are you eating enough? Have you been taking your multivitamins? Are you able to carry this pregnancy? You might have been having issue with the weight loss that are now going to be exacerbated by the pregnancy. So very, very important to keep this in mind. So therefore, if you are thinking of having a family, getting pregnant after your bariatric procedures, please wait at least a year. Make sure that you are in consultation with a bariatric surgeon and with your obstetrician, and making sure that the obstetrician and your bariatric surgeon stay in touch and communicating with each other. Make sure that you are taking your multivitamins, you are eating healthy and preparing yourself for the pregnancy. But I hope that this answers some of the questions that you may have regarding obesity surgery and pregnancy. Thank you.